Dr. Vishwanath Sagi is with us today to discuss epilepsy. We know there are 200,000 new cases diagnosed every single year. So let's start with the condition. First of all, Dr. Sagi, what exactly is epilepsy?
So epilepsy is a chronic condition of the brain characterized by a tendency to have recurrent unprovoked seizures.
Okay.
And a seizure would be a burst of abnormal and excessive electrical activity in the brain.
And what can it look like if you're seeing someone experiencing that?
So a seizure could present in different ways depending on what area of the brain it's happening. Broadly, we classify them as seizures that are starting all over the brain or the seizures that are starting in one part of the brain. So generally speaking, there could be convulsions where somebody is shaking uncontrollably with their tongue biting, urinary incontinence, things like that. Or there could be focal seizures where you would have some behavioral arrest, staring, unresponsiveness, and also rarely some aggressive behavior and inappropriate behavior and things like that.
Is there anybody who is more at risk of epilepsy?
Sure. So epilepsy in general has a bimodal distribution. What we mean by that is there is a higher incidence in the first decade of life and then in the sixth and seventh decades of life. But generally speaking, conditions like brain tumor, stroke, or an infection of the brain, traumatic brain injury, and certain genetic conditions are usually the more common predisposing conditions.
And if someone is diagnosed, what do the treatment options look like?
So the first line treatment for epilepsy at this point would be anti-seizure medications. And we have about a little over 25 FDA approved medications that we can choose from depending on the patient's type of seizures and also their other comorbidities. I would say about 7 out of 10 individuals usually respond well to medications, but there is about 25 to 30% chance that they may continue to have seizures, in which case we will have to consider more aggressive measures on a case-by-case basis, which includes some devices that help identify and stop the seizures, or sometimes brain surgery or laser therapy and things like that.
Lots of options there, which is a good thing. Do you find typically you can treat this or find some way to get it under control?
Most of the time with anti-seizure medications, we have good luck, but when they continue to have seizures, that is where we want them to have an extensive evaluation for what we call a drug-resistant epilepsy. That involves doing a scan of their brain, monitoring their brainwave activity to capture and characterize the seizures where they come from, and then also trying to find out what part of the brain has sustained any damage from the seizures, and then work as a team at a comprehensive center to figure out a best plan for them.
Well, we're lucky as a community to have U of L Health where you guys do this fantastic work. We appreciate you coming on.
Thank you.
Thank you
so
very
much.
much.